When someone in the family is seriously ill and expected to die, children and young people often sense that things are changing long before they are told the full details. Even if they don't yet understand exactly what is happening, they may notice the practical and emotional challenges affecting the whole family. Adjusting to these changes can lead to emotional and behavioural reactions, similar to those seen after a death. These may include worry or anxiety, irritability or anger, sadness, confusion, tummy or headaches, or difficulty sleeping. This is called anticipatory grief. Although it feels difficult, it's a natural and understandable reaction to challenging circumstances. Children can move back and forth between coping and getting on with things and thinking and feeling mode. This back and forth is a natural way of managing something that feels overwhelming. Most people avoid thinking about death as a way to cope with the reality that everything living eventually dies. But when someone close to us is given a terminal prognosis, this avoidance becomes harder, and families are faced with the inevitability of what is to come. Adults manage this in different ways. Some want to be very involved and take control of as much as possible. Others find it too painful to think or talk about. Children and young people can respond the same way. They may also avoid conversations about serious illness and choose to continue with their normal routines. Avoidance does not mean they are not feeling anything. It means they are using a coping strategy that feels manageable to them in the moment. Keep offering gentle opportunities to check in. Notice and name changes in mood or behaviour. They don't have to talk for you to show that you see how hard things are and that you care. When life feels unpredictable, providing children with choices can help them feel more in control and less anxious. These choices can be simple but meaningful, such as choosing whether or not they want to visit the person who is ill, deciding what to draw, play, or take with them to hospital or hospice. Having a say in family routines or tasks they can help with. Focusing on what can be controlled often helps children cope with the things that can't be changed. Children and young people still need boundaries, especially when life feels uncertain. Clear expectations help them feel safe and supported. When boundaries disappear, children can feel less secure, which may increase anxiety or lead to more challenging behaviours. Keeping routines as normal as possible and encouraging them to continue hobbies, sports, and social activities supports their sense of stability. Consistent boundaries don't ignore their feelings, rather, they create the structure children need in order to feel grounded during times of stress. Children learn as much from what you do as from what you say. Your presence, your calmness, and your willingness to talk about feelings all help them understand what coping can look like. You can model coping by naming your own feelings, sharing the small things you use to help yourself feel calmer, asking for help when you need it, being open about the fact that this is hard for everyone. This gives children permission to feel their own emotions and helps them know they can come to you. Go at their pace. Try not to assume their feelings are the same as yours. Instead, approach their experience with compassionate curiosity. Ask gentle questions, observe their behaviour, and allow them the space to express themselves in their own way. For more ideas on how to begin and guide conversations about illness, death and dying, please see our accompanying film, Communication: Examples of What You Might Say.